I'd like to welcome you to our webinar for making changes to individual enrollment information. Again, my name is Leanne Foster and I am with Provider Outreach and Education here at WPS Government Health Administrators. We'll start with our disclaimer. The material that is presented today is accurate as of today. As you know, Medicare changes often, so please make sure you are continuing to review official CMS communications, including the CMS and WPS GHA website for the most up-to-date and current CMS rules and regulations. The material that we are presenting today was created using the most current rules and CMS regulations, and I will also be using that to answer any questions that you have today. I do want to point out that photographing, screenshotting, or recording of this education for profit-making purposes is prohibited by CMS. Moments ago, you probably saw some flashing on your screen. That was me starting the recording for this session. That also means that this will be made available to you on our YouTube channel as an encore as soon as possible after today's event. That will allow you to view it again or share it with anyone who maybe was not able to attend but would find this information helpful. And just one quick reminder, if there are more questions than time allows, we will be sending out a follow-up communication with any questions and answers that you have that we maybe didn't get to today. That brings me to our agenda today. Our agenda for today, we're going to talk about how to make changes to individual enrollment information. This is going to include any group members that may be reassigning benefits to an organization, and any providers that are in private practice, or maybe they're such as a sole owner or sole proprietor. Today, that's going to include, and we're going to cover, which application is used to make changes to individual enrollment information, methods and how to submit changes both electronically and through the provider enrollment chain and ownership system, also known as PECOS, as well as through the paper application. Also going to offer up some tips and tricks and talk about some common errors that we see on specific change types. So we'll run through some of the most common changes that we see for individuals. Now again, today, as I mentioned, we are focusing on individual enrollment record information. However, I will be holding a webinar tomorrow that is going to cover organizational enrollment changes. If that's something that you're interested in and you've not registered for that event, that registration is still open and on our Lives Events page through that same link that was provided in the chat for you to access material today. So that's out there if that's something that might interest you. But again, the focus today will be on individual information and not the organizational information. To start, I want to walk through timeliness requirements for changes. Sometimes we see where changes maybe don't happen quite as timely as they should. It's maybe an afterthought. There just isn't time to do it at the time it changes. Or people... Yes?
You need to flip your slide flipped ahead for no reason. It went to application submission.
There we go. Thank you, Tom. I looked away for a second and missed that. I appreciate that. So again, with time requirements, sometimes changes just don't happen as quickly as they should. It could be a change that seems minor. How's that really going to impact anything? But it is critical that changes to enrollment record information happen as soon as possible. If we have incorrect information on the enrollment record, it does directly impact claims processing. So for example, a claim could be denied because a location is not on file and the payments are not recognizing the practice location on the claim as a practice location for that provider. Or perhaps payments will be are being paused because we've had incorrect bank account information and maybe a payment came back to us. Or even something as simple as a piece of correspondence that went out to a provider. Maybe they've moved, the address has changed. Medicare mailings cannot be forwarded, they will be returned to us, and that could cause an interruption in payments. So keeping your information current is going to ensure that your claims continue to process smoothly and help you and us avoid any payment interruptions for you. So to help with this, CMS has established timeliness guidelines for reporting changes. These are outlined in the Program Integrity Manual, also known as the PIM, Chapter 10, Section 10.4.4, Changes of Information. So a lot of changes need to be reported within 30 days. These are changes that are a little bit more of a heavy hitter as far as interrupting claims processing or just fraud prevention in general. So any adverse legal actions, if there is a conviction, that needs to be reported within 30 days of that happening. So that has to happen fairly quickly. Practice locations. Again, I mentioned if a practice location is not on file, it's not going to process, it's going to cause denials. So that's something that we need to see quickly. And then any changes to ownership or managing control. That could impact the structure of the provider transaction access number, also known as a PTAN. That could also be a scenario where there's somebody who has operational day-to-day control, such as a managing employee, that we need to know about because, again, there's potential for fraud. Not that it's going to happen, but it's more of a we need to know who has access and control over Medicare claims and the payments. Now, everything else outside of those needs to be reported within 90 days. So things like if there's a name change, if there is a correspondence address change, a contact change, there's a little bit more lead time on those. They don't directly affect claims processing as significantly as those first three, and that's the reason for the difference in those timings. So as I said, I am going to talk about common change reasons, but before we get to that, I want to talk through how to even start the application. This is going to directly impact what sections you're going to complete. So the type of change that you have, but you want to start the application correctly, or you might have some challenges further down. So change of applications can be submitted electronically through PECOS or using the CMS 855 application form, the paper form. If you've attended any of my webinars, you'll hear me say PECOS, and I stand behind this. PECOS is always going to be the most efficient way to submit an application. The processing time on an electronic application submitted through PECOS is 15 days if we have everything the first time it comes in, whereas with a paper application, it's 30 days. So that change is going to happen a lot more quickly if it comes in electronically. There's an added benefit, though, to submitting changes through PECOS, especially if it's a provider who's done so before. Once you've made that connection between the provider side of PECOS and the MAC side of PECOS, it's going to allow you to have access to view all of your enrollment data. So you're going to be able to see exactly what we currently have in a finalized state in the PECOS system, in your enrollment record, so you'll know what needs to be changed. It's also going to let you go directly into those sections and make those adjustments. And we'll talk about that a little bit more as we go through this. And if you're new to PECOS, if you're interested in trying that, maybe you haven't, maybe you've had some challenges in the past, I do just want to call out, and it was just put in the chat, recently we did hold an event just going through PECOS basics. That includes everything on how to get a user ID and password, how to make connections if you're submitting applications on a provider's behalf. Maybe you're attending as a credentialer who's working for different individuals, their organizations, need to update their organization's individual information. But it'll walk through that. It'll also walk through how to start certain application types, including a change. So that is out there as a YouTube video, if that's at all interesting to you. Now, in addition to PECOS, of course, you can always submit changes using the CMS 855 paper form for individuals. And again, we're talking about group members or providers in solo practice. The changes will always need to be made using the CMS 855I paper application. Recently, late last summer, CMS did decommission the form CMS 855R, which was at one time utilized to manage reassignments, that has now been consolidated into that 855I. So the 855I will always be the form that you're using for individuals. Now, this is a template that is available on the CMS website, and it can be completed. You can fill in the fields. In fact, it has to be completed using your computer. You cannot send this in handwritten. It's going to be returned. It has to be typed. However, you can fill it out. A paper form must be printed and then sent to us through regular mail, or just has to be sent to us through the mail. It cannot be emailed or faxed. There is not an electronic way to submit the paper CMS 855I. The only electronic method of sending an application is through PECOS. We will, however, start with how you create a paper application, just to kind of show you the guidance that it has. So with a paper application, sections 1A and section 1B are really going to guide you through creating a change on a paper application. Section 1B is really just where you're telling the MAC, you're telling us that this application is intended to change information on an existing enrollment. One thing I want to point out is that it'd be an existing enrollment in the same jurisdictional state. So if you're moving from one jurisdictional state to another, that is not technically a change. That is technically that second option where you're currently enrolled and you're moving elsewhere, or you can select new enrollee, but that is technically not a change because a new enrollment needs to be created. When you select the change, it will tell you to go to section 1B. 1B is where the application takes a deeper dive into what is changing. So in the yellow box on the left, you will see a list of different types of changes that can be accomplished through the CMS 855I. You'll get some of these similar choices in PECOS as well, and we'll talk about that in a minute. You can select more than one of these items and change more than one thing at a time. It does, however, have to be on one individual. You cannot submit one application for multiple individuals. Once you have selected the items, the next column, which is highlighted with a green box, you'll see that that has a list of different sections. And what it's doing is it's telling you, for instance, personal identifying information. It's telling you that you need to complete sections 1, 2A, 3, 12, 13 is an optional section, and then 15. Those are the sections that we have to have. You'll notice there's some overlap. That doesn't mean you have to fill out multiple section 1s, multiple section 2As. You'll look at the list for changing multiple things and only complete the sections between those types of changes that are needed. You also do not need to send in anything other than those sections and any documentation that might be needed for a particular change. You don't have to send in informational sections. If you have a change that only requires 4 sections, you only need to send in those 4 sections, not the blank pages in between. If you're going the paper route, that helps you save a little bit on mailing costs if that way, because you're not sending in the whole 30-page application. PECOS submissions look a little bit different. So to start a PECOS submission, you're going to have a user ID and password. Typically, this is going to be that same user ID and password. If you have a National Provider Identifier, an NPI, you're going to use that same user ID and password that you have. If you're acting on a provider's behalf, you would have to gain a user ID and password and make connections between yourself and that individual provider in order to make changes on their behalf. Once you've gained that access, you'll sign in to PECOS. And the first thing you'll do, and I've given you screenshots that are a little bit more zoomed in, if you will, you'll scroll all the way to the bottom where you'll actually see a listing of existing enrollments. So if this is your user ID and password, for you as a provider, it's going to be your information. If you have a user ID and password and have made connections with the providers that you work with, you're going to see a list of those providers. From there, it's going to allow you to view enrollments, and you'll see that button highlighted on that left image. From there, it takes you into all of that individual's enrollments. So if they're enrolled in a couple of states, you may see multiple existing enrollments for that individual because they'll get an enrollment record for each state. So on the image on the right is where you will actually start your change application, where you'll select that as an option. Now there's a couple things I want to point out here. Remember earlier I mentioned that PECOS is going to allow you to view everything that we currently have on file for the provider. That's what that view button that you see highlighted in a red box is. Just allows you to go in to see what's actually already there. This is an important thing to do, especially if you think it's possible another individual may have already submitted the change. You can see if that information has changed yet. If it's changed, if everything's current, everything looks good, you don't necessarily have to make the change, but you can see where something might need to be updated. That's also a helpful, kind of as an aside, that's a helpful button when you're going to revalidation. You can see everything all in one stop. To start that change, you're going to want to click on that More Options button. That More Options button is going to take you to this next page where you will be able to select the application type. From there, you'll notice there's a few options, and this can adjust based on the enrollment that you're accessing. So you may have a couple of different options, but the main options are always the same. So it's going to give you the option to deactivate, create an initial, revalidate, or the option that I have highlighted, perform a change of information to current enrollment information. This questionnaire tells PECOS, I want to make a change. This is the equivalent of the section 1A on the paper application that we just talked about. So you're going to tell the system, I want to make a change. When you click on next page, it's going to give you the screen that you see on the right. Now it's going to ask you about the change type. This is the equivalent of the section 1B that we just talked about on a paper application. There's less detail here, and there's a reason for that, and I'll talk about that in a minute. But you have two options here. Option one is something that you will use if you are adding a practice location in a different state, or for an individual provider, you're adding or changing the primary specialty and the application, it's not something where you have a physician changing to another physician specialty. The reason those are separated out, those two items are something that actually requires a new enrollment record. So what will happen is your change will kind of transition over to being an initial enrollment for an established provider because something so significant that it requires a new enrollment record is changing. And so it'll ask you a few different questions. We are going to talk about something that is truly a change. So option two is going to be if you have an internal medicine doctor who wants to go to emergency medicine. We can do that with option two. If you're adding a practice location, this would be for your providers in private practice. But if you're adding a practice location in the same state, they've got a new location, or maybe you're making a change. Somebody moved, we closed a location. Also, if you are an individual who is updating reassignment information, as far as adding a new reassignment, deactivating a reassignment, or in the case of reassignments, there is an optional field of reporting a primary and a secondary location that can be adjusted here as well. And then the last option is making any other changes. So correspondence addresses, contact addresses, provider's name. Those are some of the changes you can indicate that you're making here. Once you make that selection, you will come to the confirm reason for application screen. And this is something that you do want to review very carefully. Once you get past this screen, you can't go back and change anything. If the scenario isn't at least largely lining up, the wording might be a little bit different, but if it's not lining up with what you're trying to do, you might not be able to execute the change. You may have to delete the application that you started and create a new one. I don't want anyone to get caught in that. So what you see highlighted at the top, it's saying based on your responses to the questionnaires that we just talked about, you have told PECOS that the practitioner is currently enrolled in Medicare and the practitioner is adding, deleting, or changing general Medicare enrollment information. If it's in option 2, that is generally what it's going to come up with. If you select reassignments, it may take you down, it will take you down some other questions, and the wording will change on this to talk about the reassignments. So just make sure that that scenario makes sense for what you're trying to do before you hit that start application button, because at that point you might run into some challenges. That questionnaire, it's quick, it's simple, but it is super, super important to whether or not you'll be able to successfully submit this electronically. Once you hit the start application, you will come to the topics view. So with the paper application, it tells you exactly which sections you need to complete, and you only need to complete those sections. With PECOS, because this information is largely going to be there, it's going to take you to the topics, and they're all completed. However, it's going to allow you to go into the sections that need to be changed and allow you to make those changes. For the most part, you're going to be able to just change information. There are some changes, and the system will tell you, that will require you to end date and then add in new information. And there's a reason for this. One good example of this is practice locations. Because claims are adjudicating off of that, we want to make sure that that information is still active and valid for claims payment through the date you need. And with practice locations, it goes through date of service. So if you tell me as of March 31st, this location is no longer being utilized, we want to make sure that it's still available in the system through March 31st. So that's why you'll run into situations where they want you to end date things and add new information in. We've got to make sure we don't have any gaps. Tom, before we move on to some common changes, I just wanted to check in. Do we have any questions in the chat?
We do not have any questions right now.
All right, thank you. So common changes that'll be made to individual enrollment. Certainly this is not an all-inclusive list, but these are the most common. First and foremost is probably reassignment. Providers are joining new groups. They're maybe leaving a previous employer. Maybe they were only going to be there for 6 months, what have you. But reassignment is one of the most common changes that can be done in PECOS and on the paper 855I. We see specialty changes. We'll talk about this a little bit more, but specialty changes can be made only if the provider type isn't changing. So meaning you have a physician who is, as I mentioned before, general medicine. They want to change their specialty or add a secondary specialty of emergency medicine. We can do that. What we can't do is say you have a non-physician who now wants to change their specialty to a physician specialty. We can't do that, and that has to do with how the enrollments are set up, how claims are feed. That is going to be an event where they would actually need a new enrollment and a new PTAN issued. We'll talk about that some more. Another common change is going to be a name. Somebody legally changes their name for a multitude of reasons. We need to know that. We'll talk about the specifics for that, but change is a common change. Practice locations, again, for providers in private practice. We do see changes quite frequently for correspondence address. For providers in private practice, again, we do see banking information that has changed. Maybe their bank has moved, they've changed banks, they've changed routing numbers, and we'll talk about that. And contact information. Contact information is something pretty critical to keep up to date because that's who we are able to speak to about the application, and if they're not on file, we can't release information to them. So those are things that we would definitely want to keep up to date. So we'll start with the provider name. Changing the provider's name is considered changing identifying information. So this is going to be your section 2A. If you're on the paper application, it would be your identifying information if you are in PECOS on that electronic form. It'll be that topic. It's important to note that if we're changing the name, the previous name will remain on the enrollment record. And if you're filling it out in PECOS, it's going to take care of that for you. If you're filling out a paper application, you should be listing the new name, but you should be listing the previous name as the other. All of that needs to stay on file because there's claim history with that. It's also very important that that new name has been changed with the Social Security Administration if you're going to change it on your enrollment record. Our enrollment records have to match what's on file with the Social Security Administration. In fact, it's systematically impossible for us to make a change in the enrollment record if the Social Security Administration doesn't have their change. So that can cause delays if you're changing with the name with Medicare before Social Security has been notified or has done their thing. We are not going to be able to proceed with the application, and the old name will remain. That name also needs to be updated in the National Plan and Provider Enumeration System, also known as MPES, so the provider's MPI. That name has to be updated. You can have a previous name on the MPI as well, but the current name, the legally registered name, needs to match the SSA. And as I mentioned, that all has to be in place in order for us to change it in PECOS. It is systematically impossible. Again, I can't overstate this. It's systematically impossible for us to make a name change without the name matching in all three places. This can trigger development. So keep that in mind. Like I said, that previous name will stay on file. We do see instances where a provider may want to keep their previous name for business purposes, and they can do that in their scope of practice in their office, but they can't choose really which name they want on their enrollment record. It has to be the name on file with the Social Security Administration. But if we're putting the previous name or we're listing an other name and we have all of the names involved, the information will be there. Next, we will talk about specialty. And I mentioned this a little bit. Specialty changes are really only a change for physician specialties only. A physician can change their specialties because it doesn't change their provider type. An emergency room physician becomes a dermatologist. Completely fine. Still a physician type that can change their specialty. A physician can have multiple specialties listed. Now, claims adjudicate off that primary specialty, but we can list multiple specialties on their enrollment record. Only one's going to go over to the claims system, but in PECOS, we will be able to see all of them. What we can't change is a physician to a non-physician. I mentioned that before. Say you have an MD that now wants to be a clinical psychologist. That's great, but that is going to require us to issue a new PTAN for their practice as a clinical psychologist. And if they are not practicing it as an MD, we're going to deactivate that. And in most cases, that's what happens. We deactivate one PTAN to issue the one under the new specialty. And vice versa. If you have, say, a physician assistant who is now moving up to an MD, we're going to need to create a new PTAN and new enrollment record. And that is because of how the claims are feed. And we can't change that and process by date of service because we can't show up until, say, March 31st, they were an MD, and after that, they were a non-physician. That's not something the system allows for, and there are reasons for that. So that's something to keep in mind. Non-physicians also cannot have multiple specialties, not on one enrollment. So if you were to have a social worker who's also a psychologist, again, these are just examples, they would actually have to have separate enrollments for that. Next, we're going to talk about practice location. And again, we are talking about individuals. So this is going to be your individuals in private practice, your providers that are a sole owner or a sole proprietor, that are operating their solely owned corporation or just as an individual. When you're filling out the paper application, address information is going to give you some choices, and we're going to talk through a couple of address changes here, but you need to tell the application which address is changing. That helps narrow it down for the MAC. That helps the application make a little bit more sense as far as what needs to be completed. When you're doing a PECOS or electronic application, you'll have access to all of the sections to see the information to go in and make those changes. You can select multiple addresses to update. So maybe you're changing the practice location and the medical record storage address and correspondence. That is something that can happen on one application. We just need the sections completed for each address. If there are multiple addresses being added or removed, we need a section, and it's section 4, for each address that's being changed. One thing I want to call out specifically are moves. So that is again where we need to delete the previous address and add the new address so that claims can process for the old address for the time frame that it was active. I do want to call out that a suite change is considered a separate site. So that all needs to be reported if they renumbered the building and there's a new suite number. That would be an instance where we need to delete and remove because services would have been provided at the previous suite and now being provided at the new suite. That can get a little confusing because technically there's not a move, but it's a big enough change that it's seen as a separate address. Correspondence address. Correspondence is super important to keep up to date for a lot of reasons. One of the biggest being this is where we send out notifications for revalidation. So if that information is incorrect, you're not going to get it. Also, if we send any other correspondence there, it's going to come back if it's incorrect, and that can cause a delay in payment, and we don't want that for anybody. Now that correspondence address does have some rules. It has to be the provider. It has to be where we can contact them directly. It cannot be a billing agency, and it cannot be a medical management company. We generally have their information in a different section of the application. We're not looking to repeat that here. This is where we can contact the provider directly. So it's meant to be a separate address. Also in this section, the paper 855, it is separated a little bit. That can be the same as the correspondence address. There are checkboxes in both the paper and the electronic form that allow you to grab that information without duplicating it. And again, this is for private practice providers that are reassigning benefits. This is captured on the organization that they work for. So it's not something that someone who's reassigning benefits has to complete. Okay. So if you're filling that out for reassignments, we can save you a step. Moving on to the special payments address. This is where it's outlined as remittance notice and special payments address. Typically, we're not sending out payments on paper. That's all payments are happening electronically. But there are other types of correspondence that happen from other areas within our organization, claims areas, things of that nature that will send some information out to those. Also, revalidation notices get sent out here. And if for some reason something would happen to electronic claims transmissions, system issue, it's a backup plan. So we do need that information. There is only one allowed per provider transaction access number or PTAN. We can't split that up. If you get one PTAN, it has 15 addresses. It will have one special payments address. We are not going to be able to, and this is per CMS, be able to have a special payments address for each location. In this section, the paper form and electronic, it does also ask about medical records address. This again is for private practice individuals only. It can be the same as the practice location. This has to be a physical address, and there is a question about electronic storage. So if all of your records are electronic, there's a box, you'll say yes. It'll ask about the vendor name. We're not looking for the URL or how to access the system. They're just asking for that vendor name, and just so that we know how those records are stored, should they be needed for claims. So next is going to be banking information. So banking information includes things like the name of the bank, the routing information, which could change, account information, which maybe you've moved banks, maybe they've just had to change accounts, the owner name. These are all things that need to be reported to us very timely. Again, that's one of those 30-day reporting requirements. It can be done a couple of ways. On paper, it can be done through a CMS 588 electronic funds transfer or EFT agreement. Generally comes in as a special payments change because generally so it would be an application as well. Generally, if that information is changing, it's quite possible that special payments address is changing, and so we will ask about that. It can more easily be changed in PECOS. You will not do a separate EFT form. Instead, you will actually update the electronic funds transfer information topic with the new information. This is one, and you'll see I have it highlighted here in green. This is one of those sections where in order to change it, you have to delete the existing information. What that does is it transmits an end date to the MAC when the application comes in. And then you will add in the new. Now keep in mind, by deleting it on the application, you're not instantaneously shutting off payments to the existing information. That is just the mechanism of communicating it to the MAC. All of that information has to be vetted and inputted by the MAC before it takes effect. There are a few things that you can't change, most of which we've already spoken about, but I do want to go through those. The provider types. So like I said, specialty changes. You can't go from a physician to a non-physician or from a non-physician to a physician. There are a lot of instances where you can't go from one type of non-physician to another. So for instance, really it's none of them that you can transfer over. All non-physicians have an independent provider type. So specialty change is really just going to be for physicians when they're changing from a physician specialty to another physician specialty. A participation status, that is something that can also not be changed over the course of a normal change application. That is something that can only be changed during open enrollment, and that open enrollment period occurs towards the end of each year, usually starts in November and runs through the end of the year. If participation status were to be changed, it would be made effective for the first of the following calendar year. So that's not something that can just simply be changed. It's something that's identified when you send in the initial enrollment. Also, group members must follow suit with the participation status that their employer has selected. So that participation status would only be for private practice individuals. Other thing that we do not change is tax ID. So if you are a private practice individual that's currently practicing under a federal tax ID and you're changing to a different federal tax ID, that's technically a new enrollment. It's a new business. And we can't just change that. That again has to do with claims processing and actually come tax time, how those 1099s go out. So it has to be separate 100% of the time. We can't stop and start with that. There's one exception. If you're a provider in independent practice or private practice and you were initially enrolled under your social security number only, we can add an unincorporated tax ID. So it's not a business structure. It's just an additional tax identifier that you have for yourself, usually because you'd have employees at that point. We can add that as long as it's unincorporated. The second that tax ID is incorporated, that again is where we have to set up a separate enrollment for the provider because, again, we're setting up a separate business structure. So before we get to our next question and answer session and wrap things up, I do want to give you a few tips. So first and foremost, I'm always going to encourage electronic submission, but even beyond that, always, if you have access to PECOS, review your enrollment record. See what is currently on file. You might find that you don't have to make the change, or you might find that there are other changes that you can make at the same time and save yourself multiple applications. So make sure you're aware of what's on that file. It's also going to help you know what changes need to occur. And as I just mentioned, you can make multiple changes for the same provider as long as those changes are happening within that same PTM. Also, you want to make sure you're including documentation where appropriate. So for instance, you're changing bank account information. That's going to require a voided check or a bank letter to verify the new account information. Make sure that comes in. Okay. One thing that we do get asked with name changes is, do we need copies of a marriage license or a divorce decree? We do not need copies of that because we have mechanisms inside PECOS. There's a connection between PECOS and the Social Security Administration files. We can't see the SSA files, but PECOS will tell us if it matches. If it matches, that is our verification. We're going directly to the source through a connection those two systems have. Protects privacy and not asking you to send that type of information. The other question that we get sometimes is whether or not providers should send a copy of a Social Security card. Never send a copy of a Social Security card to us to prove a name. Again, we have a mechanism in place that's probably better than receiving that card, and we will never ask for a copy of that. It's not something we need, not something we'll ever ask for. On this slide, I've just included some resources that are out there. The first one is an article on our website for reporting changes of information. It actually is kind of akin to that section 1A and 1B, but it also includes documentation that may be needed for the type of change that you're trying to complete, and it has some helpful links for you as well. Second one is a link to the Program Integrity Manual, Chapter 10, that's Section 10.4.4 for changes of information, outlines those timelines. It does include information for individuals and organizations, but that's there for you as well. Also included a link to the Code of Federal Regulations, or CFR, that regulates and outlines requirements for changes. So you have that. So with that, Tom, I am checking in with you to see if we have any questions.
We do have some questions. I'll read you the first one. You may want to open chat too. This one's pretty long, but we have a physician/owner that is leaving our practice that is our delegated official. How can I get this changed to another physician owner within our practice? Does the delegated need to be changed first before I can notify CMS of the provider owner leaving the practice, since I will need a signature? And I assume the physician leaving can sign his own application.
It's a good question. It's a little bit more aligned with organizations, which we'll be talking about tomorrow, but I am going to take that question because it is definitely something that can get a little confusing. So you have a physician owner that's leaving your practice and they're your delegated official. You will submit, it'll be an 855B. I'm assuming it's a Part B provider. It will be an 855A if it's a Part A provider. And you will do the Section 6 to remove that individual and all of their roles, including owner and delegated official. You can then do that same section to add the individual. They may be existing, but you'll need a section to add their new role as a delegated official, provided that they qualify for that. You will add that at the same time. So you can remove the previous and add the new one on the same application versus doing two applications. And typically when you're removing a delegated official, that's not something that we're necessarily expecting them, the person that's being removed, to sign. We prefer it, but it's not something we necessarily have to have because we understand there are circumstances where they may not be available or willing to sign.
All right. Next question. Do specialty changes need to be updated in NPES before updating them in PECOS?
Excellent question. In a perfect world, they should be, but ultimately, the specialty that's listed in PECOS is typically, or excuse me, in NPES is not going to preclude us from being able to update it in um, in PECOS. However, when you start running into scenarios with taxonomy, that's where if your claim needs to leverage taxonomy versus the specialty code for some type of payment, you may run into trouble. So I highly recommend that you make those updates in MPES before you're making them in PECOS or around the same time, because MPES is a real quick update.
All right, next question. On slide 7, PECOS submission access existing information. If the application was originally done via paper, how do you access the PECOS file for the provider enrollment specialist? They do note this is the provider to perform the change or revalidation, etc. within PECOS.
That is where PECOS can probably, it is a little bit frustrating. Unfortunately, PECOS doesn't automatically come with that information attached to your user ID and password, even if you've made those connections. So that's where it can get confusing because I'm trying to update this as existing information and I can't see it. Unfortunately, until you submit at least one application of some type through PECOS for that provider, you're not going to be able to see it. So what will happen is you will submit and it will look a lot more like an initial application the first time. And that's it's going to be a little bit clunky. However, it's going to set you up to be able to see everything the next time. So one time it's going to look like an initial, but it's going to translate to us as a change because we're going to be able to see that existing information. It makes that connection on submission. After we've gotten through that application, now you're going to have access to everything that application connected to you because it saw you submit it.
All right, next question. Can the correspondence address be a PO box?
Correspondence can be a PO box, but it cannot be a billing agency or a medical management company. And they do cross-check that with any of those entities on file to identify if it is. But a correspondence can be a PO box. Medical records is one that has to be a physical location. Billing agency has to be a physical location.
All right, next. Documentation can be uploaded upon submission. Is this correct?
That is correct. So when you go to submit an electronic application, it's going to ask you if you have any documentation that you wish to upload. And if you say yes, it's going to open up a file that is going to ask you to browse, much like you would searching for a file on your computer. And there are a couple of restrictions. It has to be in a PDF or TIFF format. Basically, we can't accept image files. So PNGs, JPEGs, PECOS isn't just not designed to ingest those. And that gets submitted, again, as you do submission, but you won't be able to submit it until in the current PECOS system. The new system, they're hoping to change that so you can upload things as you fill out sections, just a little sneak peek there. But right now it is all at the end during submission. And there is a file size. One thing I want to mention, 10 megabyte file size. So if you have a lot of documents, you might have to upload them in multiple files.
All right. I was told in the past to do the reassignment of benefits through the group enrollment rather than the individual provider enrollment. Which is best?
Kind of depends on the individual provider. If you have established providers that have enrollments out there and they are joining or leaving your group, I would recommend doing it through the group because you can see everybody in one spot. It's connected to your group. You can add and delete at the same time. But if you have a provider who's brand new to the jurisdictional state or Medicare in general, you can add them as a reassignment, but we're only going to get that reassignment piece. We're still going to need the CMS 855I. So if you have a provider that's brand new to Medicare or the jurisdictional state, I would suggest you do it through the individual. Anybody who's already an existing Medicare provider somewhere in that jurisdictional state, then I would do it through the group because you can do them en masse.
All right. Last question we have right now. Can you upload wet signatures for the 855I provider and delegate in PECOS or the electronic application? What about uploading provider and delegate e-signs time date signed PDF in PECOS?
Yep, so that wet signature is definitely a thing. If you're not going to sign electronically, though I do recommend signing everybody electronically. It's cleaner. There is a little bit of a delay because that email has to go out to that signer and they've got to do the thing. Um, that makes that valid and connects the dots. You can upload a wet signature. If you're going to upload a signature, when you tell the system that you want to upload, it is going to provide you with a certification statement date that has the tracking number for that PECOS enrollment. Use that. That is ideally the certification that we want. It helps us get it linked. Electronic signatures on those paper certifications that you upload are valid as long as it's an e-sign with a time and date stamp in a PDF. That is eligible. That is acceptable.
That was our last question.
All right. So that ends our presentation for today. On behalf of myself, Tom, and everybody with GHA Provider Outreach and Education, I would like to thank you all very much for taking the time to attend today. We do look forward to those survey comments, and again, as a reminder, make sure you include topics you'd like to see in future education. Again, thank you everybody, and I hope you have a fantastic day. You may now disconnect.